Personal injury is not healthcare. It's injury care. If you can't identify all the injuries, if you can't drive a car, you should be in the passenger seat, not behind the wheel. You need to know what can be injured, and when you understand the mechanism, now you look for it.
Welcome out to the Injuries and Evidence Podcast. My name is Dr. Brandon Carter, and today we have a special guest with us. He's someone who's been in chiropractic long enough, as I can tell, to see this profession change more than once, I'm sure, and especially in personal injury. So Dr. Bill Gallagher has spent decades treating injured patients, navigating depositions, and learning, sometimes the hard way, right? Think you would agree with that?
Yes.
What it actually means to be a doctor in the legal arena. So this is not a theoretical conversation. It is it's about real cases and some real testimony and real experiences and consequences that we've seen in the personal injury world. And so Dr. Gallagher, thanks for being here.
Hey, good to be here.
It's a beautiful day. We're ready to get rocking. I'm excited. How's the weather in Arizona?
Mid-80s all week.
Really? 80s?
Yeah.
You know, we've had no snow in Utah this winter.
Really?
Yeah, it's been I think we usually see about 600 inches in the mountains, and right now we're like at 150, they're saying. So, and there are no storms on the horizon. I see nothing. So we're kind of bummed out about it, but
yeah. Well, you know what that means? Now you gotta drink Jack Daniels, not water.
That's a good point.
Yeah.
That's funny. Well, I know a few people that love their bourbon and Jack Daniel, that's for sure. So, well, it's exciting to have you on the show, and you and I have spoken a few times, and it's good to it'd be great to get to know you better. And I'm going to ask you some questions, kind of dig through a little bit on your past, and this would be great for students. I think for chiropractic students, medical students, and physical therapy students that are, you know, a part of our they're part of our podcast, and they really enjoy listening to it, and a lot of good information for them to help them look into their future, and because where you've been. So when did you go to chiropractic school? How long ago was it? Let's tap into your past. Give me and where'd you go to school, and when did you graduate?
I do have a past. I started at Sherman, September 83.
Wow.
And Donnie Epstein convinced me to go to school. And I saw him at the Wave at Life West this year. And I called him out, and I said, you convinced me 40 years ago to go back to school, so I'm holding you responsible. I did 1 year at Sherman and then went to Life West. Sherman was kind of restricted on what I can learn. Life West was wide open. I graduated in June 88. And saw my first patients 2 days later.
Wow. Seriously. So Sherman, I remember, I mean, I think that college is still it's active still, Sherman College, but Life West is where I went to school as well. And so were you in school at the time at Life West? Like, was say you go into the science world of chiropractic, and like Don Harrison, and you know, in the chiropractic biophysics world, or Dan Murphy, I think, was kind of coming into the view there back in those days. And
I had Dan as a teacher, and we had
did you really? He
yeah.
was so he was an instructor. Okay.
Yeah, and we had breakfast at a convention, and I told him there was one time where he explained with his baby face, he noted he needed to know everything cold. You had to have the study, the author, the numbers, everything. He looked around the room. Now, this is 40-odd years ago. I had a touch of gray. I'm dressed to go to clinic. Pointed right at me and said, him. The jury will believe anything he says.
Oh,
And I told him a couple of years ago, when he did that, I knew he was right. My dad, when he was the same age, got called for jury to testify as a witness on a crash he had seen 7 years before.
really?
Yeah, that's New York. It takes forever. So he got home real early in the morning, and I said, I thought you were going to be in court all day. He said, so did I. They called my name. I stood up. The other guy jumps up and says, Your Honor, can we have a recess? And went outside and settled the case. We don't
Wow.
want you in front of a jury.
Jeez.
Yeah.
Well, I think any expert witness in the situation always enjoys that experience too as well. You're like, okay, I don't have to say anything. We're
Right.
good. Um,
Uh,
and so you were there. So Dan Murphy was Don Harrison teaching at Life West as well when you
Um,
were there,
not
because that
Dawn.
was in the biophysics world, and
What do we have?
it was pretty. It was fairly new, that technique in the chiropractic
Yeah,
world
we
at the
had
time.
Malik Schlossberg doing
Oh
research.
yeah, Malik.
Yeah,
Yep. So he was teaching there a long time then, because Malik, I still use his research and his records on spinal rehab. I
yeah.
remember from after all those years.
Oh,
So were
shit.
you a student then under Malik as well, Schlossberg, Dr. Schlossberg?
Yes, I was.
Huh. Wow. What were his classes like? Was he still teaching just the research data,
Um,
or was he
Pretty
doing
much.
a different?
And he taught activator.
Oh, really?
Uh,
Okay.
it
All
was
right.
a good education. At Sherman, very first day, I went toe to toe with Tom Gilardi. He didn't want to teach the medical stuff. And I went out
Mm,
after class. I told him, You're wrong. It is not about us learning the medical language.
mhm.
We need to teach them our language.
Wow, that's awesome. And that is so true, right? We gotta teach them our language. They have to understand it from the medical perspective.
I
Huh.
had
So
dinner
yeah.
with 5 surgeons who wanted to teach. Hey, you get in front of an audience. You're the expert. People refer to you. One guy asked me, What's your education? I said, basically same as yours. Anatomy, physiology, diagnosis, dissection. We had it all.
Mhm.
And then I said, the difference, when you studied surgery and pharmacology, we studied adjusting and radiology. He was dumbfounded. I said, in fact, the average chiropractor has as much radiology as a board certified radiologist. He said, no way. I said, way. He said, how can that be? I said, how many hours do you need? He said, 300. I said, 270 in school. Yeah,
Wow. That is that is something that, like, every chiropractor needs to memorize. That line right there is what you said.
right.
If because when you are in deposition, those are questions that are gonna come up to you, right? That absolutely. So
Yeah,
if you had that line just memorized, like what you just said, I've never even thought about that before.
yeah,
Using that and making sure the insurance understands how much time that we have spent behind, the X-ray world, the
right. And
radiology department.
under oath, uh, um, yeah, they're trying to trip you up. So you're not an MD. Yes, correct. You're not a surgeon. Correct. You can't prescribe drugs. Correct. But I will never apologize for being a chiropractor.
I love that. Gosh, that is you know you know what's so here's a question for you, is, I'm kinda jumping ahead, but when it comes down to that, how often do you have you seen over all these years in your over, 40 years here almost, um, with your license, are you, seeing the medical doctors actually reach out to you? Or because I know I have, and I'm half your time in practice. I'm almost 20 years. And do you know how many of the medical side they'll contact me and say, "Hey, Dr. Carter, can you like look at this X-ray for me? Because I have a few questions on it, but I'm a little curious." It's interesting that
Right.
they're how they still use that, but the courtrooms don't ever see that. They don't see that side of it. Go ahead. What are
Well,
your thoughts on that?
yeah, I observe IMEs, and here I can video record, and which is wonderful. I can shred them, and my reports are the examining doctor did these tests incorrectly, and if his opinions are based on invalid tests. I had one guy in his report said when I finished the exam, I had to assist the patient out of his chair. After he took about 3 or 4 steps, he walked just fine. I got a hold of that and wrote a rebuttal. That is a textbook presentation of minor sign and a clear indication of a lumbar disc. Next time I observed that doctor, he came over and shook my hand.
Wow.
I have had IME doctors in the beginning would actually laugh that I was there. Now they cower.
We host this podcast for the love of personal injury. If you love PI and want to help our mission, share this podcast with a friend or on social media. Also, don't forget to check out www.pisciences.com for upcoming training and education for legal professionals and physicians who practice in personal injury. Now, back to the show.
So can we do that in do you know the laws? I'm not expecting all 50 states, but you practice now currently in Arizona, right? With that?
Yeah, right,
Um, I would imagine most states would allow someone to accompany the patient during an IME.
right,
Is
right.
that you know,
And
do
I
you know
believe
of any states that don't allow that? Just for our listeners that listen
um,
across the
I can't
country?
see that. No, I have. I've told lawyers if you send a client to an IME without an observer, that's malpractice.
Mm,
You might as well give them the phone number for the adjuster and say, see how well you can do. And the attorney going, not good enough, because the attorney has no idea what they're seeing.
yeah, they don't.
My favorite one was gait analysis.
Uh-huh.
They do this in an 8 by 10 room.
Uh-huh.
You're on a table, and they ask
Yeah.
you to get off the table and walk to the door. So now you have 6 feet. What brain will allow you to walk into the wall? You cannot do a gait analysis in that space. And I've nailed so many IME doctors on this. Now, when it's time for that, I say, let's go out in the hall. They still have no idea what to look for. They're
Uh,
surgeons. And this is the other problem. They're doing, they do surgery consults every day. Their exam is, do you need surgery? When they're doing an IME, it's based on a weekend seminar on how to write a report. And
mhm.
they come up with, it was a simple cervical strain that should have resolved in 6 to 8 weeks. And I've testified on this after the expert. So you heard the surgeon say that. I said, yes. And do you agree with him? No. Why not? He's wrong. How can you say he's wrong? the patient, for him to be correct, the patient would have been better in 6 to 8 weeks. It's that simple. I
So
got an email from that attorney 2 days later. Said, "Doc, thank you. We did very well." About 3 weeks later, I see a post on Facebook. He took his whole staff and all their family to Hawaii. He didn't take me.
didn't take you? Come on.
I don't know.
Hey, all of our listeners know we love Aloha. That is
Yeah.
our you should have been there. That's that's well, so then your confidence level to me just right now is above and beyond any other chiropractor I've ever interviewed. And how did you develop that? It's like, as you got into the personal injury world, I mean, I know it's been, again, we're talking a few decades here, but what is your advice for the practitioners out there? Because, we have our You Are the Expert seminar coming up here, virtual seminar
Yeah.
in a week and a half, and in February. And we have it a couple of times each year. And I'd love to have you on that, number one. Next time we'll plan on it. And then it's a virtual seminar for we get a lot of it on the legal side and we get a lot on the healthcare side. So but that's a great question, right? Is how do you gain that confidence in yourself?
Mm-hmm. It's very simple. It's experience. And you gain experience from making mistakes. And the biggest mistake you can make is not learning from your mistake.
Mm.
Don't repeat that. When you realize that's wrong, correct it, move on. Trust me, when I teach and people are there, deer in the headlights looks like I never thought of all of these things. And I tell them, relax. I have already made all the mistakes.
Great point. I think I've said that and I've half the time. When did you start treating PI patients then? How far out of school, or did you just immediately start within
I had one
graduation or?
when I started in clinic. And right
Oh,
off,
really?
I think it was my second patient. She comes in with a collar, with an eggshell walk. And it's like, oh, we had that in class. Here it is. That's wonderful. She came back for the second visit, carrying a collar, strolling down the hall, and said, "You're a genius." And I said, "No, I'm not. All I did was a history exam. I haven't touched you yet." But that's important. There's a relationship between you and the patient. And if it works, it works. And if it doesn't work, they're going to call somebody else.
Yeah.
Yeah.
Well, what mistakes did you make early on then with, say, like even a patient like that in the personal injury world that you learned from?
Number one, documentation. When I started in practice, right before Colossus, I could see the patient 3 months, maybe 6. When I was done, I would make a copy of my records. I would fold it over, put it in a number 10 envelope. Sometimes I needed 2 stamps. Today, my files can be 1,000 pages. Why?
Wow.
I know I need prior records. And you've been to court. The worst thing in court is when
Oh,
the defense attorney says, "So, doctor, if you knew," I didn't know that. So, prior records. I've reviewed one case with 3,000 pages. And that one was just 3 doctors. And
really?
each one had each other's records. So it was really just 1,000. I have seen a case with 2 boxes of paper.
Wow.
Yeah. And
Holy cow.
boy, they've read every single line.
Yeah. Wow. So, that's it. It's interesting that you say that because I've had that question. So one time, I think it was one of my first, I was hired as an expert in a case, probably 15 years ago. And I'm sitting in the court, I'm sitting up on the stand, and the defense attorney throws a question at me, and it was, so Dr. Carter, what can you say about the past 5 car crashes that this patient has been in? And guess what?
I did
Guess what, Dr. Bill? I had no idea. I was young. I had not a clue
right.
that there were 5 prior crashes. And my heart, I mean, it sank so deep into my gut.
Mhm.
Woo! I mean,
And
that'll wake you up really quick, right? I
right,
mean, you just go,
but that's
And I was honest.
you look
I was honest, and I said, I was not aware of the prior crashes. However, if there were any prior crashes, the way her injuries were showing now, they were acute, subacute type of injuries. And I don't know how to he asked me about apportionment on it. Can you apportion that out or anything like that? And I said, I can't apportion that out other than 100% right now for this crash. So I'm
right.
based on my testimony. And that
Yeah,
was the way I answered it. I had no idea at the time, like how to even. So you're right. You have to have that. You got to go in and experience it.
yeah, but now you'll never do that again.
Never do that again.
But my experience with personal injury is personal. Um, I lost track of all the car crashes. I've been rear-ended, sideswiped, broadside, rolled over. And for me as a teacher, I understand the mechanism. And that helps me. But I don't know. My education was literally the school of hard knocks.
And then how long so when was your first deposition? How many years into practice was that?
Oh,
Do you
I was
remember?
in practice in Santa Monica, so I was probably about maybe 2 years into practice. And it was fun. The patient fell off a curb waiting in line at a restaurant. Now, I did DNFT, so I had those funny little shoes, and they were
Oh,
sitting
yeah.
on the counter. The guy came in, handed me a check for 2 hours, and then proceeded to ask me about the shoes. And all he wanted to know was my technique. What do you do? How do you do this? And I'm fine. You're going to pay me by the hour? I'll talk. And at one point, he looked up at the clock and he realized he hadn't asked a single question about the case. Took out his checkbook and wrote a check for the next hour and asked me questions. And her attorney, of course, was there. And he was from New York, like me. and this guy finally asked the end, so, doctor, in your expert opinion, could someone actually be hurt in that situation? And I added up to here with him. And I said, it's kind of like they say on 34th Street. And her attorney lit up like, uh-oh. and I said, outside the Empire State Building, it's not the fall, it's the sudden stop that gets you. That one settled very well.
That's a great example. I like that. That's good. And so were you prepared on that first deposition? Was that were you prepared as in by way of what to expect, or did the
No,
attorney talk to you about it at all? Like, hey,
not,
this is what we have? No.
not a bit.
No.
And, well, you got a touch of gray. Makes you more credible. I've got white.
Yeah.
This is a huge asset. When I get in front of a jury, it doesn't matter. They look at me They look at the 35-year-old surgeon and say, hey, he's, yeah.
Yeah.
So the key to succeeding to success is longevity.
So what did why I mean, see, this is what I think where doctors don't get it in personal injury. What is it that motivates you to continue in the personal injury world when you have deposition expert witness opportunities? I mean, what are you trying to do? What is your passion? What's your motivation on it?
One of
Because
the
there's got to be some kind of motivation there.
Hey, for me, it's personal. And all the crashes I went through, medicine failed me. My voice, I went to the chief of speech pathology at NYU, and he said, "You're having a nervous breakdown." No, I've got 3 fractures on the left side of my neck, and that affects my diaphragm. But they don't know. So it is personal. And a common question that I get at the beginning of anything is, are you an advocate for the patient? And my response is, no, I'm an advocate for the truth.
I like that. It's a great response. Yeah, it's unbiased, right? You're still coming in just, hey, let's. So then that's so it's more of a personal thing for you in your life where you're like, hey, I've been through a lot and now I want to support the truth, the science behind this, right? Is that
Right.
kind of your
And
thinking?
I know what happens, and I know nobody's very good at diagnosing it. I've had 4 rides in an ambulance, one of which I remember. And you know what? No one ever diagnosed a concussion. I had back surgery 3 years ago. The disc extrusion was 24 millimeters. That's a full inch.
No kidding.
It is the
Jeez.
first time that a doctor
Wow.
ever did a straight leg raise test on me.
Are you serious? No kidding. How often do you see that in would you say in the on the medical side versus the chiropractic side?
Uh,
Because that's like a daily test on my end,
that's
with
the definitive test.
it
Really.
is.
Yeah. Now I've seen IMA doctors, normal or normal. The positive straight leg raise test is 35 to 70 degrees. I have seen an IME doctor take it up to about 45, get no response, and put it down. I have a video of a doctor who wrote the straight leg raise test was negative. And I did this with a friend. We replayed it 3 times. He never did the test. That offer went
Wow.
0 to 83,000 in 2 days.
Oh, I imagine so.
Yeah,
Huh.
but
Yeah.
that's all.
So so for you as as an instructor in the college life, life, how long have you been teaching there? What's your background there and what do you usually what is your instruction on? What is your course?
Oh, at Life West last weekend, I did the ABCs of PI. It's a survey. And during the class, a new subject. And I will say, online, we have 10 hours on this subject. Online, we have 15 hours on this topic. But the course is designed for somebody like you, a refresher course. And it's also designed for somebody who knows nothing and doesn't even want to do personal injury. At least now they know how not to mess it up.
Yeah. Yeah, yeah. Do you go over orthopedic tests and that and neuro I mean the entire examination side or with that training or
I did
or
point out one IME that I observed. The woman had almost lost her feet. They managed to save them. So the neurologist did beautiful testing. He tested muscle strength. Um, he tested soft touch, deep touch, sharp touch, vibration, temperature, negative on everything. And then he said, let me check your pedal pulse. And he put his thumbs on her ankles.
Okay.
And I had blood coming out of my cheeks because you got a pulse in your thumb. You don't check a pulse with your thumb.
That's right.
It's like you
That's
did such a beautiful job and you just messed it up.
so what you have to do then with someone like you as a practitioner in the personal injury world, sounds like you have to go back to your basics again of history, inspection, percussion, palpation, instrumentation, range
Right.
of motion, orthopedic tests, know those tests, all of them, right? Would you agree?
OPQRST, everything. But number one,
Oh,
most important is history. And I've
history.
developed a cloud-based history that the patient gets a link. They do it at home where they feel comfortable. So when they come in, you've got everything. And
Yeah.
I've got the experience. There are so many questions to ask that even if you know them, you can't ask them all. And to
Mhm.
really do a good comprehensive history would take at least an hour. Can't do it.
Yeah.
So now we simplified it.
Yeah. 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 We have the technology now. What do you think of that compared to back in the days 3 decades ago, 4 decades ago?
Uh, yeah, I had a deposition recently, and the guy was trying to find out what I knew. And I don't remember the question, but it was a young associate with a senior partner. So the associate is asking the questions. And I just shook my head and I said, my first calculator was a slide rule. The older guy got it, the younger guy went right over his head.
Wow.
Uh,
Yeah, I would have, definitely failed at UC Davis in Northern California there in my calculus year of calculus, that's for sure, with the
yeah.
slide rule. No, I think we used the, TI-83 calculators, those were amazing. And now you could probably just type it in on AI systems, and
Mm.
there's your
It was
answer.
in high school. A kid next to me in algebra, his father worked for Texas Instruments. He had a calculator. It was about that big.
Wow, yeah.
Yeah. He was not allowed to bring it to school.
Really?
Yeah.
Man,
We were taught how to think, how to calculate.
yeah, you were. That's super awesome, man.
Lost arts.
So, a question on deposition, what behavior as a chiropractor in deposition, like, instantly damages your credibility as a practicing physician? Have
Hmm.
you had any can you have any, thoughts on that? I have a few thoughts of my own, but I wanna hear your
Uh,
opinion.
Kiss. Keep it simple, stupid. Um, Answer the question. That's it. Let the lawyer figure out the next question. I had one deposition that was like 3.5 hours, and the guy had another half hour, and he was running out of questions. So he sits back and he says, so, Dr. Gallagher, will you agree with me? And before he could get out the word that, I said, no, I probably wouldn't agree with you on much of anything. He laughed and I said, you asked a question, I answered your question.
Ooh, and I have a question for you. Have you ever had an insurance attorney? Just kidding. Defense attorney. Have you ever had them ask you to do an updated examination on the client, on the patient?
No, never have.
I never had out of all the years in practice, and again, it's half the time you've been around on that. And however, several years ago, I was in a deposition, and the attorney goes, it's been a long time since he's been examined. And this is the defense side. He says, it's been a long time since this patient's been examined. So, Dr. Carter, would you mind doing an updated exam on the patient? That'd be great. And I was like, okay. I mean, it really threw me off. After all the depositions I've had now over all these years,
But
I had never had that happen. So I'm curious on your end if you have, because you've had a lot more than me.
no, never have. But I'm doing mainly paper reviews and rebuttals. But the exam at the beginning of care is the one I want. And I don't care if they stop treating at 6 months. If I can establish MMI even at 6 months, that's it. If I've got
Yeah.
MMI, yeah, you want to pay somebody else to question my impairment rating? Yeah, but no, the book says, here it is, maximum
Mhm.
medical improvement.
So how important is an impairment rating, do you think, in case by case?
Oh, that's Jim Mathis. Dollars and cents. It's worth 80% of your case. That if you don't have it, you have effectively told them there is no permanent injury. Everything has resolved. And if that's the case, they will pay you for your inconvenience. No more pain and suffering.
Mhm.
Yeah, and it's not that difficult once you've learned how to do them. It's priceless.
Yeah. So whenever we get into duties under duress and loss of enjoyment, if that's not included, an impairment rating is not going to be accepted. And if there's no impairment rating from an impairment examiner, then the future care plan can't be accepted as well.
Right.
Is that correct?
Right, right. And the activities of daily living don't count. I just
Yeah.
did one
ADLs for sure.
this morning, young woman, police reported a car landed on top of their car. Now, I've seen plenty of rollovers, but I've never seen a car land on top of a car.
Oh,
First
seriously?
fracture at C1,
Ooh.
C6, C7, T2. Compression fractures at T3, 4, and 5. Now, here's the beautiful thing. On an impairment rating, if you have a disc, you need a radiculopathy to go with it.
Sure.
If you
Yep.
have a compression fracture, you may have a radiculopathy.
Mm-hmm.
Now, this is from the crash to the emergency department. Next
Mhm.
morning, they did surgeries. Nobody ever
Mhm.
checked muscle strength or anything else. This was critical, life and death. So there was no documentation of radiculopathy on day one. But
Mhm.
because I could go with compression fractures,
Compression.
21%.
What does it come to? What was it?
1%.
Oh, 21%.
Thoracic.
So what do you think that the attorneys don't understand then? Because in my mind, I'm thinking whole person impairment, right? So I'm thinking if I lost 20% of even 21% of my body, that's a significant number where I think a lot of legal teams, when I've talked to them, they go, well, it's only 10% or 15% whole person, or whatever impairment. And for some reason, they think this is what they're thinking. And this is what I've heard from a lot of different sides from that an insurance company is not going to think that's a big number, They're thinking like, why is it not 80%? And I'm like, well, think of 80%. They're
Yeah.
not crawling out the door. It's ADLs. We're talking activity of daily living, functional loss, That's the way I'll explain it.
I did.
So
They
you
said,
explain it to our legal side. Let's hear it because there's a lot of legal people that listen to our podcast and
Good.
how important that impairment is.
And I had this in a class I did with an attorney. 277 people in a theater. And I'm on the stage, and he's down there going, stretch it out. So I'm on impairment ratings. I said, well, okay, let me tell you about my case. I wore a hard collar for 9 months. Today, that's malpractice.
Yeah. Yeah.
One fine spring day, I walked to the park, and a 3-on-3 game had broken up. So I took off the collar, picked up basketball, took a shot from 10 feet, went back, picked up the collar, and I walked home in tears. Not because I missed a shot, which I did by a mile. Not even because of the shot of electricity in my hands from bouncing. But the realization, I'm not going to play basketball. That's over. Past minutes. So I said, now it gets better. I played in a church league. These were the guys who didn't make the high school team. Good competition. One season, I led the league in scoring because we opened up the first game of the season the night before everybody else. I go up for a rebound. Some guy climbs up my back. Ref blows the whistle. This was back when we took foul shots. So I made the foul shot. We're up 1-0. I led the league in scoring until we got to the other end. Now I'm second in the league. It gets better. It gets better.
Let's hear more.
I said, game time for the All-Star game. The guy on my team, no question, said, I can't. My cousin's getting married. They go to the next guy. I said, I got a family thing too. They come to me. I said, really? If I was that good, you would have come to me first. Okay, so back to the attorney. Let me tell you what your demand is going to look like. My client played basketball, led the league in scoring, was selected for the All-Star team, and because of the injuries sustained, can never play again. He fell out of his seat. So that's exactly what I would write. The impairment, the injuries are real. But what I really lost was a game that I loved. That hurt.
Yeah. Well, and if you go to AMA Guides, I don't care what edition. I mean, 5th edition is one that I'm more trained on rather than 6th. But I still keep up. We can use the 5th edition in Utah, but it does say that functional loss is. That's what the interpretation of an impairment rating is about, functional loss, and then whether that leads to disability.
Right.
Correct? So
now, functional
loss is, as long as we're addressing that in documentation, is that something that you do not see on your peer-to-peer or peer reviews, or do you see that discussion in those notes?
Really, very rarely. And, one of the problems with documentation, and I call it the 2-hour rule. 2 hours after the patient leaves, you won't remember half of what they told you. So take 2 minutes and write it down now. You just can't do it at the end of the day. Do it now. And there are so many things the patient says. Nowadays, I know a lot of people have a scribe come in with a laptop and get everything. But if it ain't written down, it didn't happen. And most of it is not written down.
I love that. If it isn't written down, it didn't happen.
No.
Amen. That's a good way to end that off. That's awesome. So for chiropractors graduating today, what do they need to understand then about PI work? Not only chiropractors, but again, physical therapists, medical doctors, anybody going in the PI world, because there is a lot of that happening right now since health insurance is not really paying out, and
Mhm.
and they are seeing the cases coming in, and now their interest is like, wow, maybe we should do more trauma care for patients. And so, what is your
Mm.
what do they need to understand about PI first
Simple,
before they ever take their first case? Like, what would you say?
very simple. Personal injury is not health care. It's injury care. If you can't identify all the injuries, if you can't drive a car, you should be in the passenger seat, not behind the wheel.
Mm,
You need to know what can be injured, and when you understand the mechanism, now you look for it. And boy, it's there. The classic one. And then there's so much research. Um, Michael Freeman and Scott Rosa on their Chiari study in 2010, they found 23.3% of the whiplash cases in an upright MRI had tonsils descending.
mm,
That means 1 out of 4 whiplash cases we have ever worked with probably had a measurable brain injury. But because we didn't know to look for it, we never found it. And I asked Michael, I said, I'm seeing that. But when I see it, that space between the tonsils and the brainstem is obliterated. So now you got pressure on cranulars 8, 9, 10, and 11, and 12. And his response was, we never considered that. And then he gave me an outline on how to do the study. So I don't have a staff of 17 experts like you, Michael. I don't have the time.
So I see it all the time. No Chiari malformation on supine MRI.
Yeah.
Is it more common in upright MRI? Like if you were sending them
Uh,
over to, I know Life West, I've had a few patients fly out to Life Chiropractic College
yeah.
to go to the upright imaging, and there was a significant difference. Now, a few
Yes.
people though that I've talked to, radiologists, they say, there's not much of a difference between upright and supine, so don't worry about it.
Right. Um, actually, at Life West, Brian Gatman was one of the authors of the study. Now, 23.3% of the whiplash cases on an upright MRI had that cerebellar tonsillar ectopia. I don't remember on the recumbent, I think it was about 5%, which was way above conventional wisdom at the time of less than 1%. Now, here's the big thing, and I had this with an expert that Chris Pergam introduced into the AMA guidance. And she pointed out Michael Freeman's study says 1 millimeter, and a conventional wisdom was 3 to 5 millimeters. I said, yes, it was a study in 2020 that found with 0 to 3 millimeters, there was greater prevalence of symptomology. So you
Mm.
don't have to go deep. It's there. And
So,
hey, when you treat a patient who says, I've got this, yeah, they've got it. And that's my bottom line. I don't care what the expert's opinion is. I got a test. Says you got it.
yeah, yeah. So is that a would that be considered, I mean, when the tonsils are coming below, through the foramen magnum, when we're talking tonsil or are we talking more of a spinal cord concussion type concussion in
Uh,
those situations, or
that
is
was
that
my point, Michael, that when they drop, they move over and the interstitial space is obliterated. Now you have pressure on the medulla. But when they drop, it becomes a plug. So your cerebral spinal fluid becomes cerebral fluid and spinal fluid. And I have a neurosurgeon who he was so excited when I mentioned it. He said, "Oh, I did one of those recently, and it was the most amazing thing. Every single heartbeat, it goes up and down, up and down."
Really? Are you
Yeah,
serious?
that's a
Like,
perspective you and I would not get.
yeah, that is intriguing. Holy cow. So he's seeing that spinal cord in a sense, the tonsils coming down, moving with each heartbeat, with
Right,
each
right.
wow.
Because as the blood comes through,
And it's because of that
it
pressure.
surge. Huh?
Wow, that's fascinating.
And they didn't teach us that at Life West.
Oh, no, you're not gonna learn that.
Now,
You're
I
just gonna learn how to
graduated
pass boards.
in '88, and Steve Yeomans, I love him. I love his
Yeah,
book, but he wrote the
yeah.
book after I graduated. Art Croft wrote the book right about when I graduated. When
Wow.
I was in school, none of this stuff. There was in the 2024 updates, the AMA guides, they cited a study that in 1950 it had taken 50 years of medical knowledge to double. As of 2020, they estimate that rate to be every 73 days.
Wow.
There is so
Jeez.
much research, so many people asking deeper questions.
Mhm.
Yeah, if you can't
Well,
keep up, you're in trouble.
yeah, you can't. Well, and how any one other question, and then I'll let you go.
Yeah.
Um, how how often are you seeing no imaging or no MRIs on a case by case basis? Is it just me, or are doctors not living up to a standard?
Yeah,
Which, from what we say with PI Sciences, is you have a standard. And what I was taught, I remember 20 something years ago, I think at Life West, was if there's any trauma, then you move your X-ray over. At least start with X-rays before you even check range of motion,
right.
orthopedic tests, neurological tests. I remember that sitting there in a classroom and they said that to me, and I wrote it down. And then years later with the first PI case, I said, "Wait a minute, there's no X-rays. So what are you seeing?" Because I see it all the time.
I have called attorneys and asked, "Can you send me the radiology reports?" We don't have any. Oh, you don't have a very good PI case. You got a damn good malpractice case, but not a PI case. There was one here. Um, the chiropractor treated 6 months on a whiplash. The attorney asked, "Are you going to do any testing?" And the chiropractor said, "No, we don't need to. I can do this with my hands." At 6 months, the attorney pulled the client aside and said, "I can't tell you what to do with your health care, but you might want to go ask your primary care doctor." They did an MRI. There were 3 discs indenting the cord. The impairment rating I did today, with 3 burst fractures and 3 compression fractures from C1 to T5, with fusion, cages, pulling out fragments from the cord, everything.
Mm.
She had minimal complaints when she got to the hospital. The EMT report, the only positive finding they had was edema around her wrist that had been fractured. Nothing here. But
Wow.
they took the precaution of immobilizing her.
Okay.
And every radiology guideline I have seen has a clause in there that says, in the absence of trauma.
So what do you think's going on? Why are people not taking the imaging? I mean, do you think it's a big X-ray radiation push right now, or is that what's going on, or with
Radiation
chiropractors?
minimal. MRI is no radiation at all.
Yeah,
Um, I think it's just a lack of knowledge,
yeah.
which is
Okay.
why chiropractors who don't want to do a PI case should take my class. Let
Yeah.
them know, if you don't do this, you're going to be in trouble. And
So
I
how
tell
often are How often are you teaching that class at Life West? How often do you have
Um,
it? Let our listeners know so they
yeah,
can jump on.
I did it in October. I did it last weekend, and I'll probably do it one more time in the spring. Um,
Okay.
in California, continuing ed to get it approved is $116 per hour. So it's close to $1,400 to get
Whoa.
that approved.
So do you so you do provide some CEs with it then? Or do you just
Yes,
okay,
Life
okay,
West. Right.
okay, at
And
Life West.
and the
So
rest
they
of
go
it,
to Life Chiropractic or what is it, lifewest.edu to sign up for that? I
yes,
think it's I think
right.
it's lifewest.edu if I'm right.
Yeah. Or you got my email. Send me an email.
Yeah, and
Yeah.
it's Dr. Bill Gallagher at yahoo.com, right? Is that right?
Right. And
Okay.
be advised, you'll probably get an answer from me around 3 in the morning.
That's true. You do.
Uh,
Okay, and then just to close, if there's one thing that you want doctors listening to take seriously, something they should act on immediately today with their personal injury cases, what is it?
one thing.
One
One
thing,
thing.
like they could start doing today.
Um, the key to personal injury, besides knowing how to diagnose, what to look for, the key is documentation. You've got to have it in the records. I went to get my teeth cleaned about 6 months ago. The dental hygienist had a plaque on her counter, and it says, I may not be able to fix it, but I can document it. And she
Ooh.
asked me, have there been any health changes? Has there changes in medications? And I was, wow, that's what everybody should be doing. So, yeah,
Uh,
if it ain't written down, it didn't happen. There's another one from John Wooden that I love. Um, and he said, if you don't have time to do it right, when will you have time to do it over?
mm, that's a great ending note. I love it. That
Uh,
is you're amazing. I really appreciate your time on here. I mean, I truly respect you and your knowledge, your experience, and I know one thing I had to do many years ago was actually start taking this step though to be an expert witness or tell an attorney, hey, I'm willing to go to bat for you. Um, just here's the research on the case, and I can see the science on it,
uh,
and I'll come in with an unbiased opinion. And then I started getting hired on as an expert over, 17, 18 years ago. And but it did take me to step out into that road, so to speak. And I think that's what a lot of chiropractors and MDs and PTs, I think they get a little nervous about that they're going to be in court or something like that. And,
that's a
and,
huge concern. And I know
yeah,
medical doctors won't even touch a PI case. One, they want to be paid upfront, and two, they don't want to go to court. Now, I was having breakfast with a couple of lawyers, and they said, we can't get anybody to go to court. And I said, me. I said, you'll go? I said, you're going to pay me to read the records? I'll go out all day long.
so it does take a very unique personality then to,
Yeah. Hey,
and maybe
yeah,
that's where you and I seem to it seems like I've known you forever, and I have only met you a few times over the phone, and that's it. I've never even shaken your hand yet, but I love you as a brother and as a chiropractor, and I think that's
likewise. And that's a point that everybody needs to understand. Like I said, when I started, these books hadn't even written yet. This was not even common knowledge. When you started, at least you had some books to work with,
good.
but still, what we have learned since then, and now it's not just me, it's not just you. There are people who have good PI programs, and we need to get together and pool our resources and make something really good. One last point. My
Yep.
150 hour program, after which you can take a test administered by the national board. And I wrote the test. A young doctor in Kentucky took the classes, passed the test, went to the state board in Kentucky. They accepted that and made him a personal injury specialist, gave him an extra certification.
Wow.
One state down, 49 to go. And you're involved in that project.
We are. Let's do it.
Yeah, let's
You
do
know,
it.
I'm with you every step of the way,
Good.
and I will always learn. I love sitting on the shoulders of giants, and you know, I've studied under some of the greatest at
Mhm.
Life Chiropractic College West. I think that's a probably I mean that's top notch. I didn't expect that, but it is top notch. And for the research side, where most of the other chiropractic colleges, I'm not seeing the chiropractors coming out and knowing and understanding the
Oh,
science behind you know, and the art, you know, and a bit of the philosophy as well, you know, that the body heals itself, and it's a process. But once that tissue's damaged, and unfortunately, it can be permanent.
yeah.
And that's you know, and that's where fell in love with having an actual guides like AMA Guides Fifth back in the day, many years ago, where it actually said to me straight up on page 392 under category 4 that you could have what alteration of motion segment integrity. And guess how it's identified? And it says with radiographic flexion and extension. And I'll never forget the day, and all of my listeners know that I sat back after reading that and I said, wait a minute, flexion extension radiographs, how many practitioners are taking flexion extensions so you can identify that if there is AOMSI?
Right.
And that's so essential with this entire process. And then I found, I mean, it had to be a couple of months later, we did a flexion extension x-ray on a whiplash patient year and a half later, but C2 on C3 was 4 millimeters of anterior translation. It looked normal on neutral, but then on no, it was like 1.7 millimeters translation on neutral. It started looking nasty, and she had headaches galore and like concussion symptoms, and she was going to a chiropractor, and there were no x-rays taken. And then she came in to see me, and we took the flexion extension views, and it went up to 4 millimeters. And I kind of panicked. It was significant translation of C2
Yeah.
on C3. And my heart sunk for her. She ended up seeing a neurosurgeon, and the surgeon said, you know, that's so unstable. And he videoed, I'll have to send it to you. He videoed the surgery, and he grabs the spinous process of C2 and he
Wow.
wiggled it. And you could, that thing move. I mean, if you've ever dissected a cadaver, you're like grabbing on to a spinous, and there's no movement to it at all. It's just
Mhm.
stuck. And he like wiggles that thing like it's just jello in there.
Yep.
And he says, "Here's your problem right here." And then she had to have a fusion at C2, C3. That was the only thing that they did was that. And you know, of course, you don't want to have the surgeries, but man, it was very unstable. And she was going through a lot of symptoms. And
I'm
but
sure.
that's that page 392, cervical spine after whiplash injury. It's pretty it's confusing why practitioners don't do that more. And maybe it's like you said, lack of knowledge.
Yeah, that's it. They don't know. We're taught how to adjust. We're taught about the magic of the adjustment. We're taught about how the body heals, but we're not taught trauma.
That's right. Good. All right, Dr. Gallagher. It's been
My
great.
pleasure.
I've spent 60 minutes with you, not 30, but I could keep going for a few more hours. This has been fantastic. I love it. Everybody, all of our listeners, we hope you reach out to Dr. Gallagher. Any questions, send them to him. And you can connect with PI Sciences on our side always, like you know, and we'll connect you with Dr. Bill Gallagher. And Bill's an amazing, I feel a great connection with him and in this personal injury process, and it is a road ahead of us for sure. We've got a lot miles to go,
Yes.
hills to climb, but we can make it. So
Yeah.
thanks for listening, and thanks for being on with us today, Dr. Bill. Appreciate your time. Have a wonderful day.
Thanks for listening to Injuries and Evidence. If this episode added value, subscribe to PI Sciences and grab our free gift, a 60-minute training called A to Z in Personal Injury. It includes all the tools we use every day to strengthen documentation and improve case outcomes. The link is in the show notes. Use it. Don't leave value on the table. We'll see you on the next one.